Physician assistants are playing an increasingly important role in dermatology care across the United States. Today, I am delighted to be chatting with Laura Bush, a physician assistant who serves as the current president of the Society of Dermatology Physician Assistants, SDPA for short, where she continues to help shape the roles PAs play in dermatology. In this episode, we are going to discuss the evolving role of physician assistants in dermatology, exploring how their contributions have grown and impacted patient care over the years. Laura, welcome. I am so excited to chat with you.
Thank you so much for having me, Dr. Kopelman. It's a pleasure to
Of,
be here.
of course. So let's talk about the impact that PAs are having in dermatology today. What do you feel is the most significant contribution that PAs, physician assistants, are making in dermatology?
So, derm PAs contribute to the healthcare system in many ways. We are often seeing the front line of dermatology in both medical, surgical, and cosmetic conditions. We're filling a need, increasing access to care, and decreasing wait times. PAs help address the shortage of dermatologists, especially in underserved areas, improving access to dermatology, and caring for a broader patient population. We collaborate closely with our dermatologists and other healthcare professionals for team-based care. And we play a key role, I believe, in triaging patients, identifying urgent cases, managing patient flow, and contributing to the efficient functioning of dermatology practices. So our goal as derm PAs is to provide high-quality, patient-centered care. We provide value through our diverse skill set, our adaptability, and our collaborative approach to healthcare.
Well, this is really great because PAs, you see more and more of them, and they really do make an impact and a difference in the dermatology community. Are there specific areas where PAs have made, you would say, the deepest impact in this community?
Absolutely. I think we're flexible and we rise to our position in our practice. So each practice kind of utilizes PAs a little differently, and that largely is guided by their supervising or collaborating physician. I think PAs make a huge impact on the lives of their patients, and I can't tell you how many times a patient reminds me of something positive that resulted from my care. Some examples of this are completely changing the life of a child with the new treatment options for severe eczema or acne, diagnosing a Merkel cell when they came in for another benign condition or complaint, relieving itch in someone whose life was completely consumed by it, or improving a pigmentary disorder like vitiligo, which is so face forward to the public. These are huge rewards that PAs can give to their patients, and that really feels good.
Very gratifying. So, what do growth in the specialty of physician assistants, what do you think has led to the rise of PAs in dermatology over the past decade?
Well, first of all, I think there's a growing demand for dermatologic services. I think there's increasing needs of patients with skin conditions. Looking back at the history of our profession, Dr. Eugene Stead started the first PA program in Duke University in 1965, almost 60 years ago. The creation of this PA profession was a response to physician shortage and increasing demands for medical care. The number of doctors trained in dermatology simply can't keep up with the growth of the patient population and the disease burden. More patients need care now with our growing and aging population. Also, post-COVID, healthcare has changed. Patients have changed. Our clinics are overflowing. Wait times are long. More providers are needed for the care of these patients. There's increasing patient loads, and hiring new providers is very challenging. There's also new advanced treatments for conditions in dermatology, and there's sort of been an explosion of new treatments in psoriasis, atopic derm, inflammatory conditions. These treatments didn't exist in the past, and now they do, and they're driving patients into our clinics. So there's not only an increased number of patients, but there's also an increased number of treatments available now. And these all these factors play a role in the need for more clinicians who are trained in dermatology. And this is where I think PAs can rise to the call.
Yeah, I mean, it's really incredible the need and there's still a wait time for patients that exist to
It's
see
crazy.
dermatologists and PAs. So, it really has helped the specialty tremendously. What challenges and opportunities does this increasing trend present?
So I think because of this rapid growth of the profession, one major challenge is accessing education. Training for dermatology is really a continuous need. We don't just want to take care of our patients, we want to take excellent, comprehensive care of our derm patients. So, this requires derm PAs to be sort of forever learners, striving to keep up with these many dermatology treatment advances. And another challenge beyond that is insurance. I think there's a constantly changing insurance requirements, and this is making it challenging for patients to get their medications covered and for us to get paid for services. So keeping up to date with that is an enormous need and a challenge. This growth of the PA profession also creates huge opportunities. We can help more patients. We can offset the burden of physicians. We can play a role in education for physicians, patients, clinicians, and in the entire healthcare team. So we can play a crucial role in supporting our physicians and our colleagues.
And I'm sure you could relate because, say, a psoriasis patient who requires a biologic, that could be a very long process and tedious for both the patient and the provider. So it's very helpful to have this extra assistance and care, provided in this community.
Mm-hmm. And there are more and more patients that are now on biologics and on these newer treatments, and they need monitoring. And this is something that I think derm PAs are suited to do, well suited.
So now let's talk about dermatology in the teledermatology space, virtual care. How is the growing field of teledermatology shaping dermatological care?
I think there's several points to make. One is it's allowing for accessibility. So it's improving the access. So patients that may be in an underserved area or have geographical barriers, can't get into the clinic, homebound, or they just can't get off work, it's allowing patient care. It's allowing for more timely consultations. If you have a patient that needs something urgently and it's 4:30 and they can't get into your clinic, you could easily jump on a teledermatology call and take care of that. It's allowing for continuity of care. So, for instance, I have a patient that I started on psoriasis treatment, but now he has trouble leaving his home, and I can do more convenient follow up. Also, I can do convenient follow up for kids that are in the city in school and can't make it down to my clinic. Patient empowerment. It allows patients to be able to communicate. And a lot of times they communicate to my staff or myself via our patient portal, and teledermatology allows for that communication. Also, it adds to efficiency. It enhances the overall efficiency of healthcare, I think, by streamlining things and reducing wait times. And you can actually help a larger volume of people and appropriately triage it. So you might be able to jump on something and go, oh no, I have to see that in person, or no, I don't. I can take care of this. So I think it has many advantages.
Yeah, and I think that, the pandemic kind of opened the door to this virtual care opportunity, but now we see that it's still important and still could be useful in many ways. And it can, and I know from my friends' perspectives who have kids and families, they say like, I've been putting off going to the doctor because I just don't want to hire a babysitter or I don't have time. I have another kid at home. So the ability to be able to just call in virtually or send it over a picture has been very helpful and convenient. So, what are the unique advantages and challenges of teledermatology from a PA's perspective?
Well, I think one of the advantages, there are several advantages, but one of them is we can increase our reach, right? So we can increase our reach to areas that are short of care. We can also do these consultations. We can use it to our advantage with collaborating with other providers. So, and also people don't have to take time off work. Like you said, your friends don't want to take out time off work or hire a babysitter. I personally love this option for my own care because, and my mother loves it. She has a difficult time getting out of the house. So she will opt for a virtual appointment over a regular appointment any day of the week. And I think in dermatology, there's so much follow-up care that maybe takes just a quick check-in that we can increase that reach to more patients. We can also efficiently triage using the teledermatology. I think that it's a way of prioritizing what really needs to be seen. We also can collaborate with our physician who may be in another office. We can, and I do that quite frequently with other providers, even with rheumatology or infectious disease or wound care. And I might have to get on a call with them and discuss the patient. So that helps. Education and outreach. I think PAs can use teledermatology for education, providing resources to both patients and colleagues. I think there are some challenges, and we all saw those during COVID, didn't we? So a couple of them, technological barriers, definitely. So sometimes they lack the necessary technology for effective teledermatology. Sometimes I saw the ceiling fan, sometimes I saw things I probably shouldn't have seen. And often the patients' pictures were blurry, so we had Wi-Fi issues. I think there's still a learning curve on that post-COVID. Also, I think there's diagnostic limitations because sometimes with derm, you want to touch it, feel it, see it, and not being able to touch it physically is hard sometimes. The lack of that hands-on procedure. Although I think that's an area that maybe when we can utilize some of the genomic tests that are out there. I think during COVID, people had mailed genomic tests to patients to check their mole.
Right.
Patient privacy concerns, I think, are an issue with internet security. We have to have training to know, what are the appropriate privacy conditions we need to have to do teledermatology. And I think as this field evolves, we'll have more integration into derm care, but there's going to be an ongoing effort to address these limitations.
Yeah, I certainly agree with you because I always remember this one story I was doing. I had a patient visit, it was COVID, and he was due for his full body exam, and we didn't know when the clinic was going to open again. So he said, "Yeah, I have some new moles. Let me bring you into the bathroom." He took off his shirt, and he had like two mirrors, a front and back, and he was going like this with his phone, and he was trying to get it in all the angles. And I said, I could kind of see, but I could miss it, so this is not really working the way it should. I think since then we've kind of figured out how to do that better. But that was like one of the beginning challenges with it. How do you see that technology? We have a lot of advancements in technology, and it's transforming the role that we practice. How do you see that transforming the role of PAs in dermatology?
I think it can do this in countless ways, and it's constantly changing. So teledermatology, we can expand on remote consultations, performing virtual consultations, providing more timely care and helping more people. We can utilize the teledermatology for patients who don't have transportation, maybe in a nursing home. It's actually more cost efficient when done right and everything goes smoothly. And I say that with everything goes smoothly because often it didn't. But I even used it with patients that were in a nursing home, and I had the nurse's aide show me the rash. And so it made it a lot easier because it was very expensive for them to come in the clinic. And sometimes I couldn't make it over there. So I think I'm one of the few that still actually sometimes goes to look at my patients when they transfer into some sort of memory care or something like that.
Right.
So, but I think it adds a whole nother way PAs can be utilized. Also, image sharing. I think that that's going to be a great deal for learning. We can do the preliminary evaluations with images, and sometimes patients will send me an image. They think something's infected, they had a surgery, they had Mohs, and like, what is going on? They send it to me, and if I see a big hematoma, I'm like, no, you have to come in. So I think that helps. Dermoscopy, allowing us to analyze and magnify these lesions and aiding in the early detection of melanoma. I think that's a technology that's going to be helpful. And then photography for documentation. No, this is controversial. I, as a PA, do digital photography for monitoring, and it allows me to track subtle changes, and my patients seem to really like it. Um, our EHRs are becoming more comprehensive, and I think they're facilitating better coordination of care. So we can access their records instantly, we can look at their results, and I can do that real time in the room with them. That I think is really important. And I also believe telehealth platforms in general is nice for secure messaging and ensuring that patients can get to their provider quickly. Um, Also, I think technology, we're going to do a lot with training. And I wanted to touch on something that happened with me with my alma mater, and I think it's yours too, Emory. Emory has a virtual reality anatomy program that they do with the PA students actually do it, which is crazy that they're doing it before even the medical students are, but it was very cool. You put on a headset, you put your virtual reality on, and you go into this room and you're touching this large body and you're able to move body parts. You're able to look at just the skin or the bones, and you're able to look at all the different body systems. And then they found that when they do that, then they go into the anatomy lab with the cadavers, which they share with the medical students, and they're so much better at learning their anatomy when they do that virtual and the hands-on. And so the virtual is hands-on, but it was very cool, and that's expanding into PA programs, which I think is really great.
That is so
um,
cool.
it's amazing. You can actually make the body like 10 feet tall, or you can make it little. You can each touch the different things, and it has everything labeled. So it was a very cool experience. Also, online training programs. I think PAs can access a lot of online courses and modules to stay up to date. They can do webinars at lunch. The SDPA has a great access to this for our members. And also, PAs specifically, technology will allow us to have in-depth consultation with our physicians, right? Our collaborating physician might not be in the same office as us or might not be there that day. And we can actually get on technology and be able to share a case. And I think that's worked wonderful for me. Or even if I want to just give my physician a heads up, like, hey, I have this case. Do you think this is, we're on the right track with this? Here's the photos, here's the, and I can send it to him in real time and he can see it pop up, and then we can discuss it. Also, I think a cool technology is using genomics testing to assist in your diagnostic and treatment decisions. I think, I utilize, I'm not sure if I'm allowed to say names, but DermTech and Castle testing. I think they're fabulous. And in the right hands and the right education, I think they're very useful diagnostic tools and treatment regimen tools. So I'm really
Certainly.
excited about how technology is going.
And I think like the things you mentioned, especially the virtual reality, is such a great educational tool because
Mhm.
if I had that going back to medical school, I feel like I would have performed better in the catheter lab, and I would have instead of I would walk into the catheter lab, and it was like my first time seeing it outside of a textbook, so it's hard to like learn on the spot and remember it. But it's like a great way for to use the virtual reality to kind of like be able to touch it and see it for the first time beyond your textbook, and then you can always go back to that outside of the catheter lab. So that's a great educational tool and should be, I'm assuming, used more and more in the future.
Well, honestly, it's very if you think about it, it's cost efficient. But what was interesting was I had the opportunity to go to Emory, and I donated some money for the program just for the opportunity to go try it out, which was very cool. I'd do it again, actually. Um, and I thought to myself the same thing when I was at Emory learning anatomy. I had the cadaver for only a certain amount of time. They were in different stages. I had to, so that tool alone, and I thought to myself, how could you take this technology and expand it in the future to like rashes or psoriasis conditions? And then you go in a virtual sense, put a headset on, and you've now your patient has that disease. I mean, that is the future. That is where we are going. And then think about it. You don't have to spend all this money to like you might have to have some cadavers, of course, but I think that it is a great way to learn. I'm
That
very
certainly
excited
is.
about it.
And sorry, I made a mistake. I said catheter lab, but I meant cadaver lab. I guess
Yeah,
I have catheters on my
I
mind.
got, well, you
Um,
might help in the
mm,
catheter lab too, because think
mm,
about it. You would learn your vascular anatomy. You can actually take those virtual realities and you can actually just put vessels, lymph nodes. Where all are your lymph nodes? What's the, just every part of your body, you can take it apart.
it's incredible. So let's switch gears a little bit and talk. I would really love to know from your perspective, Laura, what is the role you think that PAs could play in relation to other professionals like nurse practitioners, dermatologists, medical assistants? I just would love to learn how you feel about this from your own perspective.
So I think PAs, NPs, and dermatologists all contribute to the healthcare team. I think that can be complementary, we're collaborative, and I think that this will ensure patients receive the comprehensive coordinated care they need for a wide variety of conditions. And I'll give you an example. Some of my NP colleagues, they're like specialists in psoriasis. I have a PA colleague who does the HS clinic. She is a specialist in HS. She does it every day. My physician does a lot of Mohs surgery. He is so good at Mohs surgery, right? So I think we can all complement one another. I always say in my clinic, there are things that I do very well. I am the rash girl and the like bad lesion, bad ulcer person in my area, right? But there might be somebody or HS or that sort of thing. That's who they come to, right? But they're going to go to, if you have to have your basal cell taken off your nose, you're going to go to my dermatologist. He does an excellent job, right? And so I think that we can all add our gifts together and we can work really well together, right? So I think we're complementary, and I don't think it's a competition or a any kind of, I think we should work together and take good care of the patients.
I agree. I certainly think it's a collaborative, effort to enhance the quality of care.
Yeah, it
So,
100% improves the quality of care. 100%.
so for SDPA, what are the main objectives and initiatives under your leadership?
So, first of all, we are 4,700 members strong and growing. We are much more than a meeting. That I want to get that out there. We are an organization that represents all derm PAs across the country, which is really important because we do a lot of other things for derm PAs beyond put on educational conferences. So there are a lot of meetings popping up and conferences popping up, but we do stuff for our members continually throughout the year. We are a source of education in many ways. So I think increasing our membership as the organization for the United States is really important because our numbers, along with derm NPs and dermatologists to help patients, is really powerful. Um, my mission, or how I see the SDPA, is that we increase access to education resources. The SDPA provides these resources along many different platforms. So we help as many diverse learners as possible. And I would like to compare it to, I always say this is, I'm one that does this, I compare things to things. And I'd like to compare it to a food menu. So some people want to take a quick bite. They just want a small education clip of something for 5 minutes while they're waiting on their kids in the carpool line. Others learn best at in-person conferences. They want to go, we have 2 of these a year. which are very fun. You should attend one. Some learn best with distance education courses that they can do at their own pace. And now others crave online dermcast presentations or that are on hot topics in dermatology. But in the end, the SDPA is here to serve its members. The SDPA is run by derm PAs for derm PAs, and we provide support for PAs that are coming new into the specialty. So our ultimate goal at the SDPA, and my personal goal, is to become the best trained clinician, because ultimately we're in this for patient care. I always tell patients, like, we get into this because we want to take good care of you. We want to provide good care. And so that is our goal. It's not to make you wait. It's not to aggravate you. It is to provide good care. And I think that's how the STPA can support derm PAs, so we take great care of patients.
Yeah, and you're allowing for professional development, which is so important. What future roles and responsibilities do you envision for PAs in dermatology? Do you think that it will continue to expand? I do think that, from my perspective, looking back over time, like PAs have been given more and more independence and ability to do things on their own and to do more and more different types of care, not and they're not like pigeonholed into doing one specific task.
Absolutely. I'll share with you, I've been a PA for 32 years, so I have seen the evolution of the PA profession, and I would say definitely increased responsibilities. I think procedural expertise. Think about how we can help HS patients if we're great at de-roofing, right? Increased role in educating our peers and our patients, increasing the telehealth integration and increasing our role in research and professional writing, mentorship, and the continued collaboration with our physicians. I think that is really important to PAs, is that we stay in that healthcare team collaboration model. That's just important to PAs in general.
And do you think that there will be a specific area that you think PAs will focus on more in the coming years besides the procedural role?
I think complex medical care and being able to triage it out to multidisciplinary specialties. So, working well with other providers in other areas and taking whole care of patients. I think PAs are tuned to be able to help with research, and that we can also be good with advocacy and education. I think that PAs can educate other PAs and can also be huge advocates for conditions and patients and providers, right? We can be advocates for ourselves. So,
Certainly.
and
And
physicians.
I mean, I could tell you I've worked with physicians and I can't, like, they really rely on their PAs and the PAs rely on them. It's really like a collaborative effort and both of them are dependent on each other. So,
Yeah.
like, I don't think that we could function without you. Um, so, this community is growing, which is remarkable. What advice would you offer to someone who is an aspiring PA interested in dermatology?
Well, first of all, it is a huge privilege to practice as a derm PA. It's a huge privilege and a responsibility. I'd say work hard, make connections, don't give up. I would think that you just have to have your heart in it and care for patients. But derm has been just a wonderful field, wonderful. And I do honestly, personally accept it as a privilege to take care of these patients and be part of this community.
And before we wrap up, Laura, is there one or a specific defining moment that you could share with us in your several years in this field?
So I'm just going to say that, and I'd like to touch on this because early in my career, I started working with the first dermatologist I work with is Dr. Michelle Futrell. And Dr. Futrell taught me that you need to treat patients as if they're your brother, your sister, your mother, that they're your family member, that you need to be compassionate about their quality of life and not be afraid to treat them, to treat them early. So if you if you had somebody that was 90 years old and was suffering, but it was a little risky, but they would get better quality of life, that you should consider that. She was a wonderful mentor to me. And I still feel her presence in everything I do as a practicing PA. Um, she unfortunately passed away during COVID of breast cancer, but she was probably just the hugest impact on my life as a practicing PA. And I think one thing that I learned out of that is that all of us can be mentors to someone else. And we never know who's really watching what we're doing or what the impact that we're making on them. But if you think about it, I am sure there's someone you impacted and you gave like that twinge of like, oh, I can do this too. And I think that if you just need to really care for patients, keep up to date, mentor your colleagues. And to me, as SDPA president, I want the organization to stay strong. I want to advance the profession, and I want to take wonderful care of our patients.
Thank you so much, Laura, for your time. It was great speaking to you today. I hope you enjoyed this episode of the Derm Club podcast. If you found the discussion today to be valuable, please subscribe and share. I look forward to seeing you in the next episode as we continue to delve into dermatology and skincare with the world experts.